People may have problems with alcohol dependence without calling themselves an alcoholic. They begin to have problems at work, absenteeism, going in late. They have problems with their family, their relationships, their children. They may develop financial problems, and many of them develop legal problems with DUIs. I've had several patients who have been with me for 3.5 years, very soon after the medicine was first developed, and they're still here. They're leading normal lives, they're taking care of their families, they're taking care of their jobs. They come and see me, they get prescriptions for their medication, and they're able to go on and live their lives. Many of those people choose not to try to taper off their medication. They feel that if they did, they would just be a prime candidate to relapse and ruin their lives again. Many people who have already tried 28-day treatment programs and abstinence-based programs and have failed at that find a great deal of success here with the treatment we do here with medication. We're able to relieve their painful withdrawal symptoms, we're able to relieve their craving for medications, and they do very well here.
Okay.
We're seeing great success rates with the patients that come here. We're able to give them medicine that curtails their cravings, curtails their desire to use, curtails their painful withdrawal symptoms, and they're able to go back to their lives and to their families and their jobs. Often these improvements take place in 3 or 4 days. And I have a number of great success stories. I actually have had a number of patients in the past couple weeks who have been suffering from the disease of addiction for years. Their lives were a mess. They were on the verge of losing their jobs. They couldn't take care of their families. And after being treated by me here at the Bel Air Center for Addictions, they came in and they thanked me for giving them back to their families for the holidays. They have wonderful lives. They're able to work. They're able to take care of their families, and they don't feel sick anymore.
And who?
Addiction is not a matter of willpower. So many patients who have been to other programs where they emphasize that if you really want to quit, you can quit, and have failed those programs, do better with a medication that curtails their cravings and curtails their withdrawal symptoms.
Dr.
You're correct. For all other medical problems, we have modern medical treatments that we treat those diseases with. People with high blood pressure take medicine, people with diabetes take medicine, people with depression take medicine. The only disease we treat without medicine is addiction. The 12-step program and abstinence-based programs, that was all we had to treat addiction. That treatment is now 70 years old. When it was all that we had, then that's what we used. Now we have new medicines that have been developed that can affect the brain's reward system and really control a person's urge to use drugs and alcohol, and we need to transition addiction treatment to allow for the use of those medications back in mainstream medicine. Sure. We treat all kinds of medical problems with medicines. We treat high blood pressure with medicine, we treat diabetes with medicine, we treat depression with medicine. For a long time, abstinence-based counseling, 12-step programs were the only treatment we had for addiction. That treatment is now over 70 years old. There's not another disease in medicine that we treat with 70-year-old protocols. Now we're fortunate to have discovered some new medications which can actually work on the brain's reward system and affect someone's cravings to use drugs and alcohol. And we need to move addiction treatment back into mainstream medicine, back into mainstream of medicine where we can use medicines to treat it. And the end flubbed up. Current theories of addiction tell us that addiction is a disease of the brain's reward system. Once a person has been addicted to opioid or narcotic drugs, their reward system is changed, and those changes may be permanent. With medication, we're able to correct for some of those changes, much like we do when we treat people for depression and we treat them with antidepressants. We can correct the changes that have taken place in the brain receptors, and that lets people get back to a normal life.
You mentioned it.
This treatment's been out for about 4 years, and I've had patients on it for about 3.5 years, and it now looks like it's probably the most effective treatment for addiction that we've ever developed. The biggest misconception about addiction in general is that it's a problem that's confined to the streets of Baltimore, with people living on the streets injecting heroin into their arms. The biggest problem with addiction is in the communities where many more people are addicted to narcotic pain medication than to all other drugs combined. The biggest misconception about addiction is that it's a problem of homeless people living on the streets in the city of Baltimore. Addiction is in every community, and the majority of people who suffer from addiction, either to prescription drugs or alcohol, are living in the communities, have families, and have jobs. The biggest misconception about addiction treatment is that it has to be done in a 28-day inpatient treatment facility or that it has to be done in a methadone clinic.
Okay.
There's more people addicted to narcotic pain pills than to most other drugs combined.
Mm-hmm.
The most surprising statistic about addiction is that there's more people addicted to narcotic pain medicines than most other drugs combined. The majority of addiction in our community is actually people that are functional addicts. They're going to work, they're struggling to take care of their families, and many of them are taking addictive medications like narcotic pain pills or alcohol to get by. That's the real problem of addiction in our communities today.